adjustment, and we will show you how to do this adjustment both prone and supine. I will show you how to do this adjustment only prone, and then later on when we do cervicals, if I'm not your TA at that point, because I know we switch things up after the test, if I'm not your TA, please ask your TA to remind you of how to adjust the first rib supine, because it looks very much like a cervical adjustment, which is why I'm saving it for another day, because we only have a little bit of time. So I will show you how to adjust prone. Okay, actually I'm not going to use this guy just for a second. Let's just remind you guys of the motion palpation that would lead you to this adjustment. I need somebody sitting here facing this wall. Actually no, facing that wall. Oh, thanks, Sarah. Okay, to remind you of the motion palpation of the first rib, put your fingers in the triangle that is created between the clavicle, the trapezius, and the sternocleidomastoid. And you laterally flex the head towards the side of testing, and you should feel the rib depress. And then you rotate the head away from the side of testing, and you should feel the rib translate anteriorly and superiorly. You're pretty okay, maybe a little bit here. Okay, so there comes a point where if your patient needs this, you may or may not feel some degree of depression, you may feel some degree of elevation, but really with this motion palpation, if this is a good position for the rib, it should really sink down when you laterally flex, and it should really translate anteriorly and superiorly when you rotate, not like this. It shouldn't do that. If it's going a little and a little, it's not moving properly. And what's happening here, okay, so I'm going to borrow you in a sec. The reason why it's not moving properly is because the rib is already in elevation. It's already in elevation and it's stuck in elevation. So as I did, okay, you can't move. As I move the head laterally, the rib doesn't depress because it's already elevated. And as I rotate the head, it doesn't move up because it's already up. So if it's up, what do you think we need to do? Bring it down. Okay, that's the whole point of this. Okay? Our point of contact is going to be the non-articulating tubercle of the first rib. It's going to be the non-articulating tubercle of the first rib. Okay? And that's going to be our contact. That's going to be our contact that we're going to use to try to bring the rib down. That's what we're doing. You can do this seated. I won't show you seated, although all the vectors that I'm going to... Once you get really good at this, you can probably create your own adjustments using precisely these vectors and stuff. So you could do this adjustment seated. I'm going to show you how to do it lying prone. Okay? But the idea is I'm going to take my contact on the non-articulating tubercle of the rib to bring it down. That's the point of this. Got it? All right. So, Sarah, you're going to lie. Actually, you know what? Let me demo on this first. Few ways to go about doing this. These rib adjustments look like thumb moves. So, you know the thumb move now? This will be very, very similar. And just like the thumb move, we can do this prone in a bunch of ways. The first way is ipsilateral. So, here's the rib. The rib is in elevation. What I'm going to be doing is my adjusting hand is going to be the hand that's furthest away from the table, just like with a thumb move. If this were a thumb move, I'd be coming in and contacting like this. But that's not my problem now. My problem is this rib, which is in elevation. This time what I'm going to be doing is I'm going to be medially deviating my hand so that this part of the knuckle of my index finger is sticking out. And I'm going to put the knuckle of my index finger onto the superior surface of the non-articulating tubercle of the rib. So already it starts to depress just by me going on that, see? Okay, I'm going to get down low. So in a thumb move, my arm was pointing in the line of drive, which was this way, but that's not my issue right now. I want this thing to go down. So my arm is actually going to be pointing inferior oblique. My thumb is going to be pointing towards the opposite PSIS. I'm going to get down low. My opposite hand is going to contact the head. The head is going to go into rotation just like it did before. He's going to breathe in and breathe out. On the breath out, I am going to rotate and traction at the head at the same time as I'm going to get my sternum over the contact. The contact now is the non-articulating tubercle of the rib. My arm is parallel to the floor. I'm going to start to push, 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 push. When I can't push anymore, it's going to be a thrust. Okay? I can also do this contralaterally, where, let's pretend it's this side that's elevated. I come and I contact like this. Just like a contralateral thumb move, but this time my contact is with the knuckle of my index finger coming onto the superior aspect of the non-articulating tubercle of the rib. My arm is going to be inferior oblique. I'm going to get down real low. He's going to breathe in and breathe out, and on the breath out, I'm going to rotate the head at the same time as I push, 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 down. And when I feel like I can't push anymore, thrust. The third way is to do this. If you're videoing me, you might want to go over here. The third way is to do it at the headpiece, like I showed you with the thumb move, where I've got the rib elevated here. I take a contact, I'm standing at the headpiece, slightly ipsilateral to the side of the lesion. The knuckle of my index finger is going to come and contact the superior aspect of the non-articulating tubercle of the rib. My thumb is inferior oblique, same line of drive as I've just showed you. The other hand is going to contact the trapezius, just like I showed you, so that I have the ability to teeter-totter the head. He's going to breathe in and breathe out. On the breath out, I'm not going to pivot my body all the way this way because then my line of drive is here. I need my line of drive inferior oblique. So what I'm going to do is I'm just going to move the head over and move my body inferior oblique. Push, push, push. And when I can't anymore, thrust. Okay. Let's show you the move that I like the most, which is at the headpiece, but you can use whichever move you want. So, was it Sarah or Holly who was helping me out?
I can do it, but it doesn't matter to me.
No, I just don't remember who I motion copied.
I think it was me, but...
It was you. Okay, come. So it was the right first rib that was elevated. I'm going to be doing the third one where I'm standing at the headpiece. You can do it however you want. It doesn't matter, just as long as all the vectors are in place. I'm going to contact the non-articulating tubercle of the first rib. How do I know that it's there? It feels kind of like a lentil underneath my finger. It's about halfway between the spinous process and the shoulder. Okay? But it feels like a lentil under my finger, and it's posterior. It's posterior, so I'm not coming in here. It's posterior, it's here. See? It's posterior. It's not here. All right. That's all good. Okay, so I'm gonna slide onto it. That's my skin slack right there. Just by applying pressure to it, I'm not able to move anymore. My other hand is going to contact underneath the trapezius. Sarah, you're going to breathe in and breathe out. On the breath out, and you're going to breathe regularly, on the breath out, I'm going to rotate your head, apply pressure, 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 inferior oblique, and finish it with a thrust that way. Let's see how this looks. Breath in. All the way out. Like that. You okay?
Yeah.
Okay.